Okay, so my name is Dr. Lam. I'm a retired acupuncturist and chiropractor. So lately I've seen this seems to be an epidemic injury regarding turf toes and Achilles tendon. So I love sports. So I've made a video for all those athletes that has been injured by this so-called epidemic. So I hope you like the video. Please comment. I don't know whether you agree with the method or not, but I've done a lot of stuff. So if I were to see these athletes, at least this is the first thing I'll do for them. As far as injury prevention concerned, I think you can also use this method for prehab, rehab, and post-surgical care. I think the team can probably set up two groups of people, one without such treatment and one without, to see which group perform better. So this is not about me. This is about the athletes. So I hope you enjoy the video. I'll talk to you later. Okay, I'm gonna step into the frame in a second. Basically, this is how you position the patient prone, face down, with the ankle 90 degree hanging off the edge of your treatment table. Here it goes. Damon Lillard, Christian McCaffrey, Tyrese Haliburton, and Kevin Durant. This is for you, man. I have to freaking stop myself. Shit. So basically, wiping alcohol, clean the area. You can wear gloves, but I'm not. Try to clean my hand. So you can palpate for where the injury is with your Achilles tendon. Usually you can, compared to the normal tissue, you can feel like some thickness, and because the collagen has been laid down randomly. So after you find your area, I'm just gonna do two needles. I mean, you guys are not my friends just yet, so I'm not gonna stuff myself all over. So 2 needles only today. So for me, I found that these are the thickened area. I ruptured my Achilles tendon before, but it's no big deal. So pull out the needle. So you want to go from P to A, posterior to anterior, aiming at the back of the tibia. So I mean, obviously, ideally, you want to put the patient face down, right? So you can go from top to bottom instead of me freaking sucking myself this way. But I've done this enough. So you position the needle, aim from P to A, pop the needle in, and slowly, you can grab the shaft of the needle. Okay, this is because this area is avascular. That's why it's slower to heal. So that's why when you stick this area, it doesn't really hurt that much. But make sure you find someone with experience. So you want to coax it. You don't want to really force it. So kind of like be gentle. So you can twirl the needle a little bit, but if you spin the needle too much, the needle might grab some of the fiber, and then it's gonna be a bitch, to take it out later. So you just want to slowly coax it in. Yeah. So if you do it on yourself, it's a lot tougher because basically you cannot aim as well. So be patient. Hey man, for anybody who's watching, I'm not saying that you should do this for yourself. Disclaimer, consult your medical doctor. But I love you guys, so this is it. So make sure you keep it straight, so you don't want the needle to stuck it out from the side. It's not gonna hurt that much, but it'll not work as well. The idea is to try to traverse the entire thickness of the Achilles tendon and your injured area. So you keep going. So just like surgery, this is all by feel. It's okay in my book to hit the periosteum of the bone, meaning the casing of the bone. It's not gonna damage nothing, because it won't. So you keep going, just like the Energizer Bunny. You keep going. Take it out. The worst thing about sticking a needle on yourself is just like aiming a gun to your head, because it's freaking coming. So basically I just try to go straight. P to A. This is a fairly small gauge needle. It's not really that big. The magic is not in the needle. The magic is in the circulation. Once you put the needle in and you put some electricity in the area, because basically this area is avascular. There's not a lot of blood supply going to the tendon, right? So you want to introduce some artificial circulation into the area. So seems like this is as far as I can go as of right now. So I'm gonna put in the second needle. Man, what I wouldn't freaking do for my friends. So same way, right? So you can put, I don't know, maybe 1.5 inches, depending on how long your Achilles tendon is. It depends on how long your scar tissue is. So same way, flick it in really quick. Like, you gotta be quick, so your nerve sensation in your brain your brain cannot catch up with the sensation. So same way, just hold on to the shaft, make sure you go vertical, P to A. In this case it's horizontal, I guess. So because the injured tissue is usually thicker than a normal tissue, so you might just take your time. Ask your practitioner, just be careful when you stick it in. Yeah, this one is a little bit smoother because the first one is really thick, so you might see this needle going in, a little bit easier than the other one. Oh, there you go. Okay. So you see this one go in quite a bit further. It doesn't matter. We're not. So the basic theory is we're trying to introduce circulation, because this is the part which is furthest away from your heart. When your heart has to pump, right? It pump all the circulation all the way down here, and has to return the circulation back to the heart, right? So it's kind of weak, as far as distance concerned. Just like how should I say it? Just like the DSL signal. If you're further away from the station, then your signal is weaker. So that's why we're doing this. Let me try to see if I can get this in a little bit more. Okay, so this one doesn't really want to go further. Maybe it's my positioning, maybe it's my technique, maybe it's the thickness of the needle. But the needle itself, today I'm using like a very thin gauge, 32 gauge plus 1.5 inch. You can see, I mean, it's not anything special, just generic needles, like disposable. Like people keep asking me every time, oh, do you guys reuse these needles? I mean, needles are so cheap, it would be stupid to reuse any needle. Basically, okay, now doesn't matter about the polarity, black and red. Just hook it up to the end of the needle. I set the timer on the needle. I mean, I would say about first session, maybe 20 minutes to whatever your trainer tell you or your client tell you to do, you know. So I'm just gonna set it as a demo. People ask me what frequency do I use, what amplitude do I don't freaking know. I really don't know. Basically, my idea is to pump blood and nutrients into the area to heal the area. So for me, I don't really know what frequency and what amplitude. Just try it out. Just whatever make you feel the most comfortable. I mean, I don't think it's necessarily you have to have certain specific frequency. I mean, think of me as your mechanic. I just do shit that works. I mean, in practical terms, I don't know. I mean, I know I have some theories, but it's not important. I charge cash, so I have to perform every time you come to me. But this is this is for you. So, and then look, I'm gonna turn on the electrical stimulation. So you want to go very slow. You'll feel like a little tingly type of sensation on a scale of 1 to 10. So the amount of tolerance you want to put up is about 6 to 7. I mean, we're not like freaking Bruce Lee. We're not trying to electrocute ourselves. So just take it easy. So I keep turning it very, very slowly, like very, very gently. But if I don't feel anything, I just keep kind of going. So now I feel a little bit of sensation. So I'm going to slow down, but I still want to keep going. Because I want, boom, you know, every session to hit. Or else, you know, why are you doing this? So at some point, so now I feel like a ticking, the sensation, kind of like from here to here. That means the circulation is going in. But I usually push a little bit further to see whether we can put more. Hey, we're in America, right? More is better. So I keep going. With the Energizer Bunny going. So right now on this thing, this is about, the maximum is 5. I'm at about 3.5. So I'm at 4 right now. I can feel some slight bit of sharpness, but it's very tolerable still. So I want to leave this on for 20 minutes. Maybe I should tune the timer starting from this point, but it doesn't matter. So basically, you know, if you want to leave the room, if you don't want to stay with your client, get like one of those, you know, remote call bell, so they can ring the freaking bell to call you instead of scream, because it might disturb other patients. So let's just say, okay, we're done with the 20 or 30 minutes allotted time. So you want to turn off the dial, and then very simply you just unhook the electrodes. So the next part is quite important. You don't want to just freaking pull the shit out. You know, you want to kind of like gently hold on to the skin of the tissue, because if not, the needle will pull your skin and then it's not comfortable and then you might bleed. So I just hold on to the tissue, like press it down a little bit, like kind of like this. and then I slowly back the needle out. Sometimes you might see a couple of drops of blood, but it's not a big deal. So I try to just back it out slowly. Just very gently back it out. So even with that, hey, no blood. Okay, we'll see about the second one. So you see my fingernail. So I'm putting quite a bit of pressure, but I'm not like pressing onto the needle. I'm just pressing onto the surrounding tissue. Make sure, you know, there's some kind of anchor when I pull the needle out, so the needle won't pull the skin. So same, press it down, slowly back the needle out. Don't twist it. So yeah, I mean, I've done this a lot. I've seen some NFL guys, some NBA guys, some high school athletes, you know, just people in general. I don't care who you are. I mean, I just try to find a way. Hey, you pay me money to solve your problem, right? So this is one of the ways. So back it out slowly, be patient. Hey, no blood. All right. I'll explain a little bit more with my face on the video.